Another dark log from the diary of a griever named John Weaver, which is me. Morning, fellow zombies. Are we alive yet? Are we awake yet? I got sombering news to say, and I've got to get the truth off my chest, because if I don't, I'm not going to be able to face you guys or anybody else for that matter. And I'm ashamed. I'm ashamed and embarrassed. And yesterday I wasn't saying anything about what happened. Let's get to the other shit here first. It's about 3:07 in the morning. It's March 15th, 2026, Friday. Okay. I know I've been wailing like crazy concerning about the... Let's get that off so I can get this moved. Get the power cord off. About my surgery on the foot, which is still needed. I am, and still, it's not was, I am and still afraid. And I haven't had the surgery on the foot yet. Debridement is a form of surgery. It is cutting into human flesh. It is cutting away dead skin to allow new skin to grow. While it's something to talk about, but it's another thing to go through it. And if you had gone through it, then you know the kind of level of pain it is to deal with a foot ulcer. Now, in December, I had that happen. Well, discovery of what was going on, and it was January that foot ulcer had to be excised. No anesthesia, no painkillers, no surgery suite, no anesthesia, no nothing. You just on an examining table with the foot elevated and let the pain and blood begin. I can make weird faces or sounds about the whole situation. If I actually had a video of it, I would have shown you the grossest thing ever, and I wasn't. I didn't film it. I'm still not. But for those who have actually gone through it, you probably would understand the complexities of it. It's simple when they're cutting with a curved razor blade. It's a hook, and they dig. And they're digging into nerve endings. They're dealing with a lot of pain because the sensories of the flesh being torn off with a razor blade, shooting through the nervous system into the head, where you are constantly under threat. It's not throbbing, it's a constant, steady stream of agony. I didn't say anything about the blood either. Yes, the morning train. Anyway, for me, going through it once was enough. But unfortunately, the body is still trying to get through other stuff. It builds up the dead tissue in certain areas where it impedes on itself, that it can't grow any further because of that deadened area. It pushes out. But it doesn't push it away from the body, it just collects it in a certain spot, which it hampers the healing of it, or it stops. And I was talking with a wound care specialist about this one. How one particular nurse figured that there was a slower way of getting rid of the stuff instead of a quicker way. Because I kept telling her how much pain it was. And he was telling me some kind of chemical to slowly eat out the dead tissue and to make it dissolved, and the new tissue would start growing. But that's not what the people wanted in the first place. I kept taking pictures every time I kept going into wound care to get an accurate picture of what it looked like. And whatever they posted, I would also save and use as a scrapbook, as a chart myself. And I had made, let's look, about 1 or 2 months ahead from one particular session of it, about almost 2 or 3 months. The progression of this thing. It's like every few days I would go in for wound care, replace the wound, the bandages, and somehow it would get to a point where if I was actually able to be healed enough to risk a shower, then I would be able to get limber enough to redo the bandages, pads and stuff. I got a duffel bag full of this stuff, of bandages, of other things that I need for it, stretchy stuff, stretchy bandages, elastic wraps, gauze pad. There's even a special pad that they used that they would have like a gauze pad, and the wound's right here. The gauze pad would be here, and it'd be soaked with fluid of sorts, antiseptic and stuff, to help stimulate and protect. It's like putting Bactine, old-fashioned Bactine, or Neosporin or something like that. You can't do that with that. There was a certain kind of stuff that they would use for it. And after you had the gauze pad on the wound and soak it right into the wound, it's supposed to help heal it. It's supposed to help in with the healing. And there was this other pad to push against the skin as to not have the stuff push out and away. And here comes the gauze, and I wrap it. And there's like a figure 8 thing going on around my foot, including around my heel. Instead of just going a direct wrap around, it was just wrapping around and going weird, where the whole foot is wrapped. And then there's the elastic bandage, and that goes on the same way too. So besides the gauze, it would also be the elastic. Of course, there'd be some tape to keep everything together. Not a whole bunch of it, just maybe a few strips. I guess in between the last elastic wrap, and then there's the gauze wrap on it. So, yeah, it's a lot of stuff. I mean, I hadn't gone through surgery. I hadn't gone through any surgical stuff, so I wouldn't know anything about this. But I'm seeing this for the first time in my own experiences of wound care. And after I took my first shower, right after all this stuff happened, and I started wrapping up myself, because I've seen these guys do this so many times. I felt like I was confident enough that after a shower, my muscles would be limber enough that I could stretch them a little bit and get the job done. This last time didn't do so well, but it wouldn't be lasting temporarily anyway. Well, the day of the appointment came. It was yesterday, on Thursday, on the 14th of May. But prior to that, it was supposed to have been in April. Because that would have been the day for it. That should have been done. Well, prior to that, it should have been done earlier than that, about a month. Because in that way, I'm looking at myself dealing more of a hardened skin as it keeps trying to grow or stop, that there's going to be major surgery on this one. But why did I stop on those 2 periods? Because I didn't want my foot sliced open. I didn't want the pain. There's no anesthesia. It's just getting rid of this thing, and that's about it. To them, it's just digging into stuff. But it's pain. The doctors aren't supposed to be creating this much pain to get rid of a wound, is it? I mean, is that it? I had sent appeals to the insurance company. I went through people to tell them my horror. And I'm waiting for an appeals to get reviewed. And they'll probably say, yes, you need to go through the surgery. But without any way of you not dealing with the pain. All right? You have to go through the pain. You have to do this. And I can't tell you how far ahead my fear had driven me to where the original podiatrist going to be doing it, I didn't want to deal with her. She may have been a nice lady. I can't fault her for that. But she's stuck in the process. There's nothing beyond just getting the cutting done, and that's it. And it doesn't matter how you feel about it. Just be nice and pleasant about it. But it doesn't matter if you cause any pain to the patient. And no painkillers given to the patient. None. Because there was a hell of a lot of pain afterwards. I had to find some pain medication at home to chew on. And then the nightmares came. I thought I was having nightmares originally concerning about the medical establishment throughout my lifetime. But this would solidify any chances of me going back to the doctor's office. So I had to switch to a different podiatrist. And then, by checking out on one particular appointment, I went to another. But this one I went to, we had conversation. But she's also convinced that cutting is the only way. But beyond the patient's comfort level on dealing with the pain, they have no clue. And that's why I had to keep telling the grievance and appeals department about that situation. Look, you guys are supposed to help heal the patient, not create more issues, not create more damage. And you're doing that. You see the physical damage, but you're not seeing beyond the physical damage. Not seeing how to. It's like trying to do major surgery on a person, and you're going back into the Civil War time. You're going to get rid of a wounded leg. They saw the damn thing out. They didn't have any anesthetics. They didn't have any knockout, or enough of it anyway, to put the patient out. They had to live with it. Scarred throughout their lives, one way or another. Even the ones in the Civil War, actually in the Revolutionary War, had to go through the same damn shit. Called the doctors sawbones. That's how I look at the podiatry now. Or any other kind of surgeon that's going to be doing surgery in their doctor's office. Because without putting the patient out and letting the work be done in there, then maybe you can revive them, and they got to deal with the patient in the wound. I mean, I could deal with it maybe about another month or two about not washing the body, because I had to get the shower the day before, the examination was supposed to be happening. I mean, Wednesday was the shower day. I had to scrub down the tub so I could actually shower and stand in there and just gently wash the feet. Gently scrub any kind of loose flesh. And everything else is toughened. And it needs surgery. Yes, in order for the body to get rid of it, it needs to be excised. Understand the process. The problem is the patient's comfort. You got to put them through a hell of a lot more help now. It's toughened more, and it's going to be even more difficult. That's why I kept telling these guys, I need outpatient surgery where they're putting me under. Not a local anesthetic. I want general, okay? I want to be put under. Because you guys are going to be working on the damn foot. I want to be sleeping through the damn thing so I don't wake up and screaming and yelling my head off. And I have to make the doctors understand this. I have to make the agreements board. If I have to keep making more and more appeals with these guys, if they say you can't do it anymore, I'm going to say bullshit. Because the thing I'm afraid of that I don't have the money for is going through the lawsuit through the courts. And I want it on record. I'm trying to keep every document I've got concerning about the situation. Look, I know it needs to be done, but you're going to be putting me through more and more hell on this one. And the longer it is, the worse it's becoming. And yesterday, I could have talked with the doctors about the situation. And I was so damn full of fear, of worse than anxiety. I'm understanding I don't want my foot turning gangrene, picking up any kind of weird-ass diseases, and I'm going to die from the damn shit. I already lost a friend on this one already. And he had something similar of this. He had an ulcer I had to get rid of. But he waited too long. Process started on him. Within a year, he was dead. And I don't want that. I don't want to go through that. If there was a way of doing surgery on the foot without me feeling enough of the pain, I want to go through that. Even if it takes a long while to get rid of the damn flesh. I don't want to have more lasting memories. They want me to come in to be treated for other things, including my diabetes, I do, and to be stabbed all the damn time for blood work, just to see how my blood sugar is. I have yet to go into the damn doctor's office for the testing of my blood. A simple pinprick. It's just a simple pinprick on you. Yeah, and it's like putting a major stone in the water and see the rippling effect. How does that affect you? Physically and emotionally? But, it's people who have to do this on a constant basis. They got more courage than I do. I'm a coward. I've been a coward all my fucking life concerning about the medical establishment. Growing up as a kid, I had no choice. But once you reach a certain age of adulthood, now I had to be responsible for my own damn health. Of course, it's still overshadowed with my family being representatives. But I still had to make the decision. And during those days, I knew I had to deal with my heart situation. But nobody was telling me that I had to deal with the type 2 diabetes or anything else regarding that thing down the road. I learned that the hard way. Observations and dealing with family members going through this shit. Then it's my turn. But my immediate family, who I depended upon a great deal, my mother and my brother, they're gone, they're dead. Their history in this world, in this life, are not here. They're not here. I'm here. I have to make the decisions about my health at this point. Whether or not I'm going to be dying one way or another. I've already been through car crashes. I've already been through open heart surgery. Wouldn't recommend that one. Broken bone. Smashed face. Yeah, mutilated my body. But I had to make the decisions on how I was going to be treated, no matter how scared I was. It's got to a point where maybe I could try going in for blood work when they're going to be doing the syringe on me. Okay, fine. Cover my face. Either you feel it or you're not, depending upon if I got it right, if I got a phlebotomist, the vampires, sticking the needles in there in a certain way or a certain fashion. And I don't feel the pinch as much. So it doesn't keep triggering my subconscious and making me freak out as much. One time, in dealing with the foot ulcer, and in dealing with an infection in the foot, they needed antibiotics going into the system. And it couldn't be pill. It had to be liquid. It had to be IV. And they had to shoot. So, they got into here. I think I still got them. Yeah, I still got a freckle somewhere in there. During the daytime, when we get light, I'll show it. But they went through a vein. Got the tube in there. And I had to keep holding my hand up like this because they couldn't have the IV bottle on my right hand side. No, they had the IV bottle on the left. So I'm constantly like this, waiting for both bags of antibiotics to go through the system. And then later on I'll be chewing down on tablets. I don't mind the tablets. I'll deal with the tablets. What I will be not liking to deal with is antibiotics and having a position like this. And I can't do anything except stay in a bed and just wait for this thing to finish on. Okay, fine. Had to deal with that. Worse, after the IVs were taken care of, and that same day I was taking care of that, they put me back over to the hospital for a CAT scan. Because they needed to find out what was going on with the foot. And I got stuck with the damn needle in there and the wrapping. And when I left the hospital, they finally took the damn thing out. I had to ask them to plead for them to do that. So for a long while, it had been sore. I had felt pain going through here because of the experience I went through. Things happen. I understand about that. What I can't understand is if I'm going to go through a surgery that's going to be taking care of this wound, I need to be put under. I am not going through the same damn shit all over again. A long time ago, when I was able to work, about 25, 30 years ago, I worked in a call center from hell. 25, almost 30 years, something like that. Anyway, I had developed a lifetime of usage with both wrists on a keyboard and pounded like crazy. So I did a lot of damage to the muscles and nerves, at least I thought. And shot through from here all the way up to the elbow. And I had talked to workers' comp doctors about this one, and they said I needed to get a nerve graft done. Electroconductive nerve study, which means they shock the crap out of you and stab you with steely needles at certain points in your arm, at least for me anyway, to determine conductivity of the nervous system. Is it nerve damage or is it muscle damage? It was muscle. But in this situation where they were stabbing me, they were stabbing in certain pain centers, and yes, it was about to nearly, almost, I think it's the same pain level because it was shooting red alerts throughout my nervous system into my brain, frying it out. And I had to go back to work that day. I had to grab a couple of Tylenol and try to work the rest of the day with sore wrists. Managed, but sore wrists. And I wasn't allowed any time off for healing. But they would put me through a months-long regime of stretching and heat exercise, and heat and cold and stuff, to get these things to a point where I'm actually able to use them again. But I would have to sleep with these things for a hell of a long while. about 25, 30 years with these things. Keep changing them every so often, so they wear out. Well, braces do wear out. But it's gotten to be a pattern and a habit right now that when I go to sleep or lay down, I have to have my braces on. Forgot all the exercises. I don't do any cold or heat on them. Not for a long while. But the pain level that I went through the graph was almost the same level as what they were doing digging into my foot, because the pain is still there. I mean, it was still echoing in my head. So I had a hell of a lot of fear, a hell of a lot of freak out, and I decided in the middle of the night, I'm losing sleep over this shit. It's bad enough I lose sleep over my dog whining her head off half the time, because she needs to be treated. And I had to take her over to the vet next week. So this weekend, I've got a lot of contemplations going on. I got a lot of decision making. I understand about the decision I still need to make, and of course the treatment that still needs to be done. But the thing is, what I want, and I got to fight these assholes on this one. So I want surgery in an operating room. Me under. They put me under general, not local, general anesthesia. I'm not going to get my foot shot up with a damn needle just yet, but I want to be sleeping through the damn shit. My insurance is paying for a lot of it. They have to be paying for this one. I need this done. I understand it, but I want it where I'm not feeling it being done. I want the outpatient surgery. But if it has to be inpatient, then okay. But I still have to check it out with the bureaucracy on this one. And the doctors. I want this. I don't want to die of gangrene. I don't want to die of anything else that my foot's going to be falling off. I don't even like the idea of having MRSA around. Flesh-eating bacteria? No, thank you. They're worried about my home, and I understand it completely, that they can't come in here to do any wound care treatments at all. There's no way in hell. This place has gotten way worse. And I need to get rid of these damn bugs or else I'm out of here. I leave. I don't know where the hell I'm going. I got no place to go. But I don't know what the hell I'm going to do about it. So I'm complaining about that one too. To the health insurance, just let them know. Look, this is... You guys tell me this is an unhealthy environment. Yeah, no shit, Sherlock. But I stay here because there's no other place to go. And I have to scrub down a toilet. Yeah, also the rest of the bathroom here. But I have to scrub down a tub shower to accommodate what I need to be done. And it has to be done. It has to be. I need the showers before I get any surgery done. I can change bandages during that time. So I have to do what I got to do to take care of me. My mother, a long time ago, when she... I'm just drinking out the... Okay, I have to do this part two. Part two.